What is Medicare and why is its solvency important to me? I'm sure many of you have seen the ads on the newspapers, magazines, on TV, and just skip by them, thinking, this doesn't matter to me, but it does. I used to do the same thing until at age 61, I am getting close to the time when I will need Medicare. The time is to learn about it now, not when it's too late. Medicare was developed by the government in 1965 and signed into law by Lyndon Johnson to protect the health and well-being of millions of Americans. The first recipient of the Medicare card was President Truman and his wife Bess. You must be 65 years old to qualify for Medicare. In 1972, Richard Nixon expanded this to allow people on Social Security, disability, and certain diseases such as end-stage renal disease after a 24-month period to use Medicare. Medicare is funded by general revenue, payroll taxes, premiums transferred from states, taxation on Social Security benefits, and interest. The first slide will show you the breakdown in 2017 on what portions of Part A, B, and D were funded by each of these means. In 2019, there will be approximately 60.6 million people on Medicare with the cost of about $706 billion a year. This is partially because of the maturation of the baby boomers. When people speak about Medicare, they normally mean the original Medicare. This consists of Part A and Part B. Part A is insurance for hospitalization, inpatient, nursing homes, skilled nursing facilities, and critical care access. It does not include long-term custodial care. It is available to people age 65 and mandatory to sign up at age 70. This insurance normally pays 80% of your bill, leaving 20% out of pocket and copays to the patient. Part B is medical insurance. Covers the same 80% of doctor's visits, screenings, ambulance services, mental health, physical and occupational therapy, and durable medical equipment. In 2019, the premium for Part B was approximately $135.50 a month, unless you qualify for financial assistance and do not exceed the 100% of the federal poverty level. Because of this fee, it is not mandatory, and you have the option of turning it down. The premium is normally deducted from your Social Security check. Part C, or Medicare Advantage plans, were enacted in 1997 via the Medicare Plus Choice Act. Part C is offered to people through Medicare-approved companies, such as Humana and United Healthcare, as an alternate option. It is a federally program, funded federally, and operates under federal rules. You must be signed up with Part A and Part B to qualify. These plans may cover dental, vision, prescription, and wellness visits. They do work like a health maintenance organization or an HMO, where they contract with certain doctors and hospitals. If you choose to use someone out of this network, your copays and out-of-pocket costs would be charged at a much higher rate. In 2014, approximately 15.7 or 30% of all Medicare recipients were on a Medicare Advantage plan. Although they look appealing at first glance, it's extremely important that you do diligence before picking one of these plans, as you do have to stay with them for an entire year or until the next open enrollment. Medicare Part D is a voluntary prescription drug benefit signed into law in 2013 by President George Bush. This was part of the Medicare Modernization Act. You have to be signed up for Part A and B to use Part D, or the Medicare medication benefit. Medication is placed on a formulary in different tiers, and depending upon what tier your medication is on is how much you would pay. Such as an example would be a generic drug would cost less than the name brand. There is about a $35 a month premium for this insurance, and again, it would be deducted right from your Social Security check. Now, if I haven't confused you yet, and you're still with me to this point, there's also a Part F, or Medigap insurance. These are private companies that provide the service through a premium that is paid on a monthly basis to help you with the out-of-pocket costs, such as the 20% in copays that Part A and B do not pay. As I mentioned earlier, there's also a Part E, or Choose Medicare, normally known as Medicare for All. Presidents, beginning with Teddy Roosevelt, have been trying to get this kind of program off the ground. There's an article that has been brought to the floor by the Democrats to help with the Ailing Affordable Care Act. It would permit, but not require, non-Medicare age individuals to opt for this health insurance, financed by premiums such as private pay insurance. This program would not replace the Affordable Care Act, just give another option. This is something that will most likely be a talking point in 2020 election. There have been many news articles recently relaying the fact that Medicare may be broke by the year 2026. This is a very scary outlook for millions of Americans, especially our elderly, who rely on this for their health care. There are always ways to assist with this possibility. In 1980, Jimmy Carter signed into law the Medicare Secondary Payer Act. This would make Medicare a secondary payer if someone else is responsible for paying, such as workman's compensation or an automobile insurance. They would only pay if these places are not able to pay. Other ways to do would be paying close attention to your Medicare bill, your explanation of benefits, knowing your bills, matching your doctor's visits to what's actually charged. Medicare fraud is one of the largest abuses of the system. A doctor or facility or the patient will bill Medicare for services that they didn't even give. It's up to each individual to stop this from happening, and fraud should be reported as soon as suspected. In conclusion, Medicare is vital government agency ensuring health care to millions of Americans. Know the various types of Medicare available and choose the best that's for you. Understand that it's not an ever-ending pot of money, and we always have to have what goes out matching what comes in. It is our duty to due diligence when on Medicare. Thank you.